Hi, Dr. Scott Jensen here, and today we're going to be talking about the heart, the brokenhearted, and those with their hearts broken. Just because the FDA declares something as safe and effective, you should not assume that it's effective and or safe. On my computer screen right here, I've got the FDA criteria for approval, and it says, according to the artificial intelligence overview, the two major criteria for the FDA to approve a drug are that it must be shown to be safe and effective for its intended use. I had a patient yesterday, and I don't mean to pick on any specific drug, but I think it helps when we talk about a specific given situation. There's a drug out there that you might not be aware of. It's called Entresto, E-N-T-R-E-S-T-O, Entresto. It's a combination drug with two different drugs in it. It's indicated for the treatment of symptomatic chronic heart failure. What are the symptoms of symptomatic chronic heart failure? They can be numerous, but first and foremost, most patients with congestive heart failure will have shortness of breath, frequently swelling in the ankles. Sometimes they'll have big puffy jugular veins up here. Sometimes their liver will swell also. They can even develop ascites or fluid in the belly. So the bottom line is shortness of breath and swelling in the ankles are big ones. But the bottom line is Entresto is supposed to be used for symptomatic congestive heart failure. So when you're having problems, if you are put on Entresto and you don't know why, and you were not having any symptoms, it sounds like someone overreached. How much does Entresto cost? Well, if you're paying for it yourself, it's going to be about $10,000 a year. Here's what another example of AI overview says. Entresto is generally not prescribed for asymptomatic patients. Major groups like the American Heart Association, the American College of Cardiology recommend its use for people with symptomatic heart failure, typically class 2 to 4 NYHA class heart failure. It goes on to say, the FDA approval and major clinic guidelines specify that the patient must have symptomatic heart failure. Symptoms generally include shortness of breath and fluid retention. Some medications are approved for asymptomatic left ventricular dysfunction, where you don't have any symptoms, but your left ventricle is not functioning well. But Entresto is not indicated for this use. Why am I picking on Entresto? I had a patient in yesterday, and he was so thoughtful. He came to me and he said, Dr. Jensen, I can't tell you how much I appreciate my last visit with you. And I said, why is that? And he said, you encouraged me to try going off the Entresto. He said, I was feeling so miserable. He said, I was going to have to make a major life change, quit my job, whatever. He said, I couldn't do it. He said, I had so much pain in my back and my pelvis, and I just felt crappy. And he said, it was amazing. When I stopped the Entresto, within a couple of days, I felt like a new person. My job was easily manageable. My spirits lifted. So I talked to my cardiologist, and they said, oh, well, let's try it again and see if it was a fluke. He tried it again. Boom. He got the symptoms right back again. Stopped it. Felt good again. Then the cardiologist tried to add something else to his regimen, and he didn't do well with that either. But the bottom line is, I thought, I got to talk about this Entresto, because here's a guy with congestive heart failure, but asymptomatic. So you could say he has his heart is broken. Okay. So I looked it up. What is the NNT for all-cause mortality? In other words, how many people have to be on Entresto to stop one person from dying? Well, in the data over and over again, it says all-cause mortality NNT for Entresto is 36. And you have to treat for at least 27 months. So if you treat someone for 2 or 3 years with Entresto, 1 out of 36 patients will be spared death. 35 out of 36 will not achieve any benefit in regards to that one endpoint, death, mortality. So 1 in 36 will benefit, 35 out of 36 will not. And you'll say, well, gee, one person not dying, that's a good thing. But if you, and the NIH, the National Institutes of Health, they had an article called, it was in the Canadian Family Physician, they've got it in their library, and it was sacubitril valsartan, novel therapy for heart failure, and it says, if 36 patients with heart failure are switched to Entresto, 1 fewer patient will die over 2.5 years, more or less. But what's the NNH? What's the number needed to harm? So if you have to take care of 36 patients for 3 years in order for one person to benefit, what harms will come from it? Here's the kicker. The NNH, or the number needed to harm for symptomatic hypotension, that means symptomatic low blood pressure. What are the symptoms of low blood pressure? Frequently profound dizziness, collapsing, falling, dropping. Sometimes from that situation, you'll break your hip. You experience a significant other injury, but the NNH is only 20. So while you're trying to get to 36 patients in order for one to benefit, you get about halfway there and you'll have hurt someone. And hurting someone might have caused a broken hip. So I think that people need to understand that just because the FDA said Entresto is safe and effective, it isn't necessarily safe. And in terms of its effectiveness, it's effective for 1 out of 36 patients in regards to death over 27 months. So then I went to artificial intelligence and said, by the way, who funded all the studies on Entresto that really helped Entresto get some momentum? It says here, the primary funder for studies on Entresto is Novartis, the manufacturer of the drug. Go figure. So that's for the people whose heart is physically broken. Let's talk about those with broken hearts, depression, anxiety. Let's talk about SSRIs. Let's talk about selective serotonin reuptake inhibitors. What's the story on those? Well, in the late 1980s, the first one out was Prozac. And then in 1991, we had Zoloft. And then in 1993, we had Paxil. If you want to read something fascinating, go read Study 329. Study 329. It's a controversial 2001 trial that initially suggested that Paxil, or paroxetine, was safe and effective for adolescents with major depression. This conclusion was later disproven in 2015, 14 years later, when the raw data was reanalyzed. The reanalysis found the drug was associated with a significantly higher rate of serious harms, including suicidal thoughts and suicidal actions. So that's Paxil. If you actually go back and look at Prozac in 1987 was released, and then in 1988, it's actually approved in 87, and 88 it was released to the public. But that was out for 17 years before 2004 came around, and the FDA issued a black box warning for SSRI antidepressants in October of 2004, indicating a potential increased risk of suicidal thinking and behavior in young people, specifically children and adolescents. Then in 2007, 3 years later, that black box warning was expanded to include young adults all the way up to age 24. Now, these are drugs that were identified as safe and effective. So in Study 329 that I mentioned regarding Paxil, there's a significant question whether there was any effectiveness. And when you see a black box warning come out 17 years after Prozac was approved in regards to suicidal actions and thoughts, you have to ask yourself the question, why did it take 17 years? Well, I went to artificial intelligence again, and it says, evidence from internal documents and lawsuits indicate that some pharmaceutical companies, notably GlaxoSmithKline, GSK, have a history of concealing or downplaying negative clinical trial data and known side effects of selective serotonin reuptake inhibitors, including information related to sexual dysfunction. I was at a conference over the last weekend, and there was discussion regarding post-SSRI sexual dysfunction. Now, again, some of these drugs can have side effects that patients and doctors don't attribute to the drug, because frequently a patient will be on a drug and tolerate it for a significant period of time. The patient I was talking to about with Entresto had been on Entresto for a year or two. So when I had suggested that there was data to indicate that his serious hip and back pain could be from Entresto, he said, well, it can't be, doctor. I've been on it for a year or two. Wrong. And that happens a lot to us in medicine. safety and effectiveness as pronounced by the FDA is frequently pronounced over a relatively short period of time with quite a small group of patients. It's when it's released on the public, where for years, millions of patients use the drugs. That's when we start to see the real picture. If you look at lisinopril, people will have a cough with lisinopril. Initially, the data said maybe 3% of the population. I would say it's 10 times that. I think 30% of the population may at times have cough from lisinopril. So just because you've taken something and tolerated it for a long period of time doesn't mean that over time it won't build up in your system and cause changes physiologically. And that's what we're seeing happen in regards to post-SSRI sexual dysfunction. There are thousands of patients across the land that because of an SSRI use experience profound sexual dysfunction, whether it's anorgasmia, whether it's genital numbness, whether it's total loss of libido. There's a significant issue going on here, and patients didn't know it. And the problem is with PSSD, post-SSRI sexual dysfunction, the symptoms don't necessarily go away just because you stop the medicine. In some situation, it appears that PSSD can go on for years. And yet, patients thought that it was safe and effective. So why am I telling you this? I think physicians need your help. Because once we start something, we think that if you don't have any problems in the first couple of months, you're good to go with it. Then we become sort of blind to the possibility that problems that you experience going down the road downstream, we just dismiss the possibility that they could be coming from this drug or this drug because you'd been on that drug for a year or two or whatever. And that's problematic. Whether you're talking about statin drugs, SSRI drugs, a drug like Entresto used to treat congestive heart failure. And a lot of times we get bamboozled into not wanting a drug to be identified as causing problems because the drug is being used for such a serious issue, congestive heart failure. Who wants to walk around with congestive heart failure and not have all the optimal possible treatments that maybe could help them? So work with your physician. Tell your doctor, something's wrong here, and I want to feel better. And if it means a trial off of a drug for a period of time, please work with me. Just because the FDA says it's safe and effective, do not assume that it's effective or safe for you in the short term or the long term. It really matters. And a lot of these drugs, you're looking at $10,000, $15,000, $20,000 a year. Dr. Scott Jensen, thank you much.